Welcome back to the show. Well, most of you have noticed it's getting dark earlier in the evenings these days. Very early. And sometimes it can be hard mentally not seeing the sun as much.
Absolutely. Joining us to talk about seasonal affective disorder is Dr. Ryan Dick from Entira Family Clinics. And so many of us are used to hearing this, right? And we feel like, okay, we're not alone. But help explain what this is, what some of the symptoms are.
Absolutely. So seasonal affective disorder is something that obviously can be very, very common. And obviously there are moments where we feel run down, but obviously there's a pattern to this where, you know, we're getting into darker weather, we get oftentimes in cooler weather. We are not obviously fulfilling a lot of our normal patterns where we're getting outside, we're exercising a lot of the same ways, we're not as energized as we used to be, and that can take its toll. So obviously people will feel more fatigued, they'll feel out of sorts, they'll feel irritable. There's obviously a wide variety of symptoms where we just are not being our normal selves.
And our internal clocks just feel like they're just upside down a bit too.
Absolutely, absolutely.
And I feel like, is this more than just like, you know, I kind of just feel down today? Is it more than that? Is it more clinical than that?
It is, it can be. Obviously there's a huge spectrum of severity in it, right? You know, and obviously from day to day, week to week, we can have that depending on how stressed our day is anyway. But I think in the end, what we're always trying to gauge is to what severity, and oftentimes we look at, well, how is this really affecting my normal day to day? We want to make sure that we can be the people that we want for our loved ones. We want to make sure we are being slightly efficient at our jobs from time to time. We want to make sure we can have fun when we really want to have fun. And so if there are points in time where we're not our normal selves, and it's really getting in the way of a lot of those things, we want to make sure that we're evaluating it, sometimes in the clinic, sometimes with a therapist, in whichever different way, so we can feel better and we can kind of establish new habits that will keep us out of that funk.
Are there more people that are more susceptible to this, or explain how it's different from a typical bout of depression?
Honestly, I think we all are susceptible in different ways. I think if there was a circumstance in which someone had a history of anxiety or depression to begin with, they're going to certainly be more prone to it anyway. But I think we're doing a really good job these days, like being more open with our feelings. It's not something where we're perceiving it as a weakness anymore. Like if you're down in the dumps and you're not your normal self, it's okay as something to talk about.
Right. Okay. So it truly has to do with the sunlight and how we're exposed to it. It affects our brains, everything, right? I mean, that's really the whole issue. We just need more sunlight.
Yes, absolutely. We think about, like you'd said before, like serotonin, norepinephrine, dopamine, all of those things. So I think they're, you know, and when those neurotransmitters are disrupted, we generally aren't our normal selves.
And other than booking a flight to sunny South Florida, like the DeRoches said,
that's always a good therapy. We always support that therapy. Yes.
But is red light therapy? You know, that's becoming more common. Would that be a helpful?
It certainly can be. Absolutely. I mean, you talk about light therapy in general. I think that red light therapy is a little bit newer, and so I think, you know, we're always looking at like what are the latest studies that look at each individual type of light therapy. It seems like light therapy in general is effective for about half of the people who use it. So it works frequently enough. You just have to be pretty religious in using it.
I know there was a light in our office at one point because we don't have windows. And so all year long, we're like, what's it like outside? So that light really does affect your mood and just how productive you are, especially in the workforce.
No, that's absolutely true.
Okay, all right. So medication though can be an option if your symptoms are severe. You can take it one step further than booking a flight or getting a light.
Absolutely. No. So I think you think about light. I think there is something called cognitive behavioral therapy where it's a lot of brain training to kind of enhance the possibility of light therapy, and then ultimately. Medication we reserve typically for what we can characterize as like moderate or more severe symptoms, and those work really well. I think people are understandably nervous about medications because they don't want to be somebody else. They don't want to feel, they don't want to get addicted to these things and become dependent on these things. But the reality is doctors who are really familiar with those medications will not allow those things to happen. And people typically do very well on those medications.
Good. Other than the issue of lack of light, what about getting outside? I know those folks that work from home, or if we're just inside constantly, just a 5-minute walk could also maybe play into this and help?
I think it's massive. I think we have to talk about neurotransmitters. How well do we feel when we get outside, we get fresh air, we get our blood pumping and all of those things. I always tease my patients that the hardest part about going for a walk or a run is putting your shoes and actually moving outside. And then once people are in the thick of it, they feel fabulous and they feel great afterwards.
Yes.
But it's always the trickiest thing, just getting out the door. And so we talk to our patients all the time, just get out the door, make it easy and simple, 5 or 10 minutes. And if you want to go a little further, then great.
Yeah, for sure. I think the really important thing to mention, and you have, is that if you're feeling like this, maybe you think maybe it is normal because it is winter, but it's okay to talk to somebody, and there's options out there. So don't stuff it down inside.
Absolutely.
Really speak out to your doctor, your friends, just someone, right?
And honestly, try to create a new routine with a friend or a family member. Like we talk about getting outside, most people or frequently can feel the same way. And creating a new simple routine and having someone join you is always a really good way to go.
I always say, do you want to go on an exercise walk or you want to go on a walk? And I text my friends. And so sometimes we do an exercise walk where we are a little faster in the clip. And sometimes we just saunter around the neighborhood.
Sauntering is fun too.
Right,
Absolutely.
and it's healthy to catch up and have that good conversation flowing too.
Oh, doctor, thank you so much. Happy holidays. Merry
Thanks for having
Christmas,
me.
and enjoy all your family time. I know you've got that coming. So if you want to learn more about Entira Family Clinics, we've got a link to visit them on TwinCitiesLive.com. You can also call them at 651-788-4444 or EntiraFamilyClinics.com.
More Twin Cities Live coming up next.